On today's Health and Wellness episode of ANOKHI Daily Spotlight TV, we'll be speaking with Dr. Sapna Makhija, who will be talking to us about a disease that we should all be aware of, colon cancer. Thank you so much for joining us here today, Dr. Makhija.
Thank you for having me.
So we're here today to talk about colon cancer. And I have to say that I don't think I know much about it myself. You know, there's a whole bunch of other different types of cancers that we learn about. So can you talk to us a little bit about, you know, some of the things that we need to know about colon cancer?
Of course. First of all, colon cancer is very common. It's the third most common cancer. It is the second most common cancer-related death. So 1 in 13 men and 1 in 15 women will be diagnosed with it in their lifetime.
Now, Dr. Makhija, can you talk to us a little bit about some of the misconceptions or myths that might exist around colon cancer out there?
Of course. So the first one would be that the procedure is painful. In fact, at most places where you will have your procedure, whether it's in the hospital or outpatient, you will be given sedation. Either it's a pain medication itself or it's just something to relax you and sedate you. It all depends on whose facility you're having it done, but the goal is to keep you entirely comfortable. The second myth would be the preparation. Now, in order for us to go in and have an adequate look, you obviously have to empty out your bowels.
Right.
That is a bit of a strenuous process, but it makes you feel good towards the end of it, and the cleaner you are, the more confident I would be as a physician that I didn't miss anything.
Right.
Now, the third misconception that most people have is that if they're feeling well or if they have a clean diet, that they don't need to get screened for colon cancer. That is entirely false. There is no known dietary link that prevents colon cancer that has good medical evidence as of yet.
And you mentioned these symptoms. Are there any that we should be looking out for before the age of 50 that would indicate that there might be an issue?
Sure. First of all, any change to your bowel habits. You should definitely make a note of your routine bowel habits and look in the toilet bowl after having a bowel movement. We've trained my 6-year-old nephew to do it every day. And so if you see blood in your stools, if you see a change in the form, like if you've been having normal bowel movements and all of a sudden your stools are always long and pencil thin like, you worry that there's something growing inside your colon that's preventing it to be a normal form stool. Weight loss, that's unexplained. Some people have just low iron levels on routine blood work, so iron deficiency anemia is usually a sign of blood loss through the gastrointestinal tract, and the most concerning cause of that would be a cancer. So the day before, what you have to do is have a clear fluid diet, so nothing that you can't see through. So that includes juices, jellos, broth if you would like something a little bit on the savory side. And then later on that day you would start a prepreparation, which is a laxative, and you drink that, and that is, it's meant to give you diarrhea, and you will be going very frequently.
So that's staying home and you're prepping.
Next morning you come in, you will need that entire day off of work and available because you're not allowed to drive after the sedation. And you just get an IV, and that's the most painful part that day. And then you're put off to sleep and you'll have the best sleep of your life. And then you get told your results by the doctor right away if there were any polyps removed or if it was clear, and then you get told your next interval, which is usually 3 years, 5 years, or 10 years depending on what's found.
So thank you so much for giving us this great information, Dr. Makhija.
Thank you for having me.
If there's anywhere that people can go to find out more information, potentially you can share that with us?
Sure, we have a website for GI Health Center. It's www.gihc.ca, and you can also find out how to get referred by your family doctor on that site.
For more of our show, catch us on ANOKHImedia.com and our YouTube channel, and be sure to interact with us on Facebook and Twitter. Don't forget to check your bowels.